So this is osteogenesis imperfecta. Now, what osteogenesis imperfecta is exactly what it sounds like. It's the imperfect formation of bone. It's really a genetic disorder where the recipe for collagen is screwed up and they make improper collagen. Now, we find most collagen in the dermis of the skin, in the adventitia of the blood vessels, in the sclera of the eyes, and in the osteoid of bone. And this is where it seems to show up the most. It as a as brittle bones. It's on page 595 of your textbook, and they call it brittle bone disorder. It's a fairly rare congenital disorder, and there's four primary subtypes, and they vary in degrees of severity and clinical presentation. And uh, and there's an awful lot of people go undiagnosed with this. So on table 14.9 in your book on page 595, there's a classification of osteogenesis imperfecta. So the type 1 is the most common form, and it also happens to be the mildest form. And so what they get is they don't get deformities in the bone. They get moderate fragility. So they get a lot of fractures, especially in growing bone. They're just very prone to fractures. They may have trouble with hearing loss because of problems in the incus malleus and stapes in the ear. They tend to have fairly small chins, a kind of a triangular face, and the thing that's kind of the weirdest of it all is that the whites of the eyes are actually blue. The sclera of the eye gets a blue tinge to it, and that's because the collagen is not correct. And what makes the white of the eyes white is the collagen that's found in the sclera. So this is kind of an abnormal form of the collagen, so therefore that's screwed up. Type 2 is actually the most severe form. Extreme fragility of bones and all the connective tissue. They usually have multiple fractures in utero. The birth is like the birth process will kill the child. So often these are stillborn or they die in early infancy. The long bones crumple, that kind of thing. It's usually perinatal lethal. So either just before birth or just after birth, these children die. Type 3 is a moderately severe form, and what it ends up with is progressive deformities. Scoliosis is a big problem. Really bad osteoporosis, fairly severe fragility of bones. So a lot of fractures, and the fractures heal with deformities. They don't heal straight, and they usually are wheelchair bound fairly early. And the type 4 is a very rare form. So these diseases these variants of osteogenesis imperfecta are autosomal dominant. It means that if a parent has it, then there's a 50% chance that their kid will get it, either mother or father. Now, a lot of these things are so mild that they go undiagnosed. They don't, so they really don't have a statistic as to how many people actually have this disease. There was a guy in massage therapy at Georgia that, after the class that I gave on this, came up to me and he told me that he had had many, many, many broken bones, especially in his teenage years, and he did have somewhat of a triangular face, and he had a definite blue tinge to his sclera. Did he have it? I don't know. I don't think it was ever diagnosed, but it was intriguing nevertheless. It was quite possible that he had it. So really, it's what this is a genetic improper making of collagen. So there's a shortage of it. There's an improper manufacture of it, and depending on how much is missing or how bad it is, gives the different types. So the signs and symptoms are all over the map, from virtually very few signs and symptoms to perinatal death. But bones fracture easily. Sometimes the kids look like victims of abuse because things that wouldn't fracture a normal kid's bones actually fracture them. They have brittle teeth, ligamentous laxity, real easy bruising because the adventitia around their blood vessels is improperly formed. Some postural deviations because the collagen in their ligaments and their and tendons is not formed correctly. It can be low muscle mass because the collagen of the endomysium, epimysium, and perimysium can be incorrect. Fairly thin parchment-like skin. But those things can happen because of other disorders, metabolic disorders of, osteoporosis sort of things. But this happens usually earlier than would be typical for osteoporosis, and they have these distinguishing triangular face, small chin sort of look to them, and this blue tint to the sclera, and oftentimes a real barrel chest, and kind of bow-leggedness to it, just because the bones are not properly formed. The long bones are properly formed. The ribs aren't properly formed. Heart valves and the chordae tendineae are made of collagen, so they can have valvular problems in the heart. That's usually a problem. The walls of the aorta could dilate, again because of valvular problems, but because the walls of the great vessels have a lot of collagen in them. Gastric esophageal reflux is a big problem because the around the esophageal hiatus there's a lot of collagen and it's not properly formed. Those are the sorts of things that they look for that are complications. They may or may not be very serious, could be life-threatening. Frequent fractures is the big thing, and they find it with biopsies or DNA tests. So let's put it this way, taking up snowboarding or martial arts or hockey is probably not a good idea if your kid has this. Although this guy that in massage therapy, he was a hockey player and he broke bones almost every hockey season, but whatever. Uh, they got to really promote bone health. Uh, yeah, those are the sorts of things that they have to deal with. Depending on the severity and the fragility of the bones, uh, probably not a good idea to be pounding on their ribs and things like that. Um, but and be on the lookout for cardiovascular problems, maybe pulmonary problems as well.